You're talking to who?
You, Dr. Waris.
Oh, I don't know how to do that. Unless I'll just talk without the video.
Yeah, with whatever you prefer, we are fine.
You tell me. You tell me what you want. I'll follow your cue. You want it with the fuzz on, or you want it off?
Lily?
Oh, okay. No preference either, by the way.
Sorry, Lily, I can hardly hear you.
I think it's good to see a face. Dr. Waris, it's okay, even with the video on.
It's not too bad.
Yeah.
So I will thank everybody who's made time for joining us this evening for this particular session. And this session is for the Down Syndrome Awareness Month. We are celebrating Down syndrome, and it has been brought to us all by T21 FSO, which is an organization that supports families who have experienced or have a loved one who has Down syndrome. So our guest for this evening is Dr. Waris, who is a pediatrician, and he specializes in pulmonology. So for anyone who's not familiar with pulmonology, and Dr. Waris would correct me later if I'm not correct, is a doctor who specializes in respiratory kind of illness, anything from the windpipe to the lungs and around the chest area. So if you're anybody who's has a loved one, a child especially who's experiencing this, then a doctor like Dr. Waris would then be the doctor you go for.
Thank you for the kind introduction. I'll just share my slides if I can.
Just 2 more seconds.
Sorry.
So just for any of the members who joined our call who are not familiar with 21 FSO, this is actually an organization that came about 5 years ago, and it stands for Trisomy 21 Family Support Organization. And trisomy was picked as a name for the organization, as it represents the extra copy of chromosome on the 21st chromosome of a baby. So that's part of why the organization selected that name. So it started with a mother who was trying to understand, having a baby with Down syndrome, where do I get the information? Where do I get the support group? It grew to 7 families and has organically grown to over 300 members across Kenya. The organization is a nonprofit and mainly relies on members' contribution, and some organizations coming in to support it with equipment, office space, and offering sponsorship of medical camps. And it is managed currently with a group of volunteers who are members to the group. So I do look forward to having Dr. Waris take us through the next hour or so. And I just wanted to share my experience with Dr. Waris. So I met him some years back, and you could really tell he loves what he does. He loves the children he looks after. And when my child was 4 years old, she actually came and said, I want to be a doctor. And I was like, oh my, where did this come from? And when I asked, she actually said, I want to be a doctor because of Dr. Waris, because I like how he takes care of babies and makes them feel better. And when I grew up, I actually want to make babies feel better. So Dr. Waris, it is a pleasure, and I hand over to you to take us through the next hour.
Thank you so much, and thank you for the kind introduction as well. I'm going to share screen. Just confirm that you can see my slides.
Yes.
Okay.
Yes, we can.
Thank you so much. And thank you all of you for attending and for sharing some time so that we can discuss together a little bit about what I do and how we can look after our little children at home from a medical perspective. And thank you so much to the organizers for organizing all this. It means a lot, and it's nice to always share information with all of you. My voice is a little bit hoarse. I'm nursing a bit of a throat infection, and I'll tell you how I'm treating myself so that we can also do the same for our children. So a lot of children, especially our little children at home who have Downs, get a lot of common colds. And these are some of the questions that I'm asked very, very often. That, oh, do we need to worry if the nasal discharge is colored? You know, I need to rush to the doctor because the nasal discharge is green or brown. And what you need to know as parents is that nasal discharge can be green and brown, but what you need to worry about more is if your child has high fevers and is vomiting. It is not strange, parents, to see that there's a little bit of blood staining in the nasal discharge as well. So you might see a streak of blood, and then parents will say, oh, but we've not seen that with the previous homas. So you can get it for some, and for some, you don't have to have it. But the important thing is that you don't have to necessarily panic. And I'll tell you when we should panic as parents and when we should rush to the doctor. A lot of people will say, oh, you know what? I felt the side of the neck of the child, and I could feel the swellings there, and there were these lymph nodes that are swollen. And what I need us to share as parents is that just because you have a swollen lymph node doesn't necessarily equal an antibiotic. And the reason why I have bullet number 3 there is that to try, and bullet number 1 actually, is to ensure that we don't always give our children, should you have Downs, should you not have Downs, it's immaterial, but it doesn't always equal an antibiotic. You'll have parents who will come and say, oh, you know, during the current homa that my child has, there's some sores in the mouth. And that usually means it's a viral infection. And the reason I'm sharing this with you is that that is a virus. For those of you who know me, you'll know that this is not my normal voice. So you can tell it's a little bit hoarse. And that's clear indication of a viral infection. So a hoarse voice wouldn't get an antibiotic. So these are just some of the tips I wanted to share, that you can have some blood-stained nasal discharge, a lymph node doesn't equal an antibiotic, etc. So when would I rush? And this is now for all children. I would rush to the casualty or to the doctors if you're having persistent high fevers for at least 24 hours, if not 36. For children who have Down syndrome, you'd want to err on the side of safety. And so this would be between 18 and 24 hours. You wouldn't want to last longer than that. If you see that the cough is worsening over 1 or 2 days, as soon as you see your child pulling at his or her ear in apparent pain, that is something that you need to take seriously. Children who have Down syndrome sometimes have eustachian tube that is sometimes a little bit smaller, so they're prone to getting ear infections. So we need to also look out for that. Our children may not necessarily turn on and say, oh, mommy, my ear is hurting. But if they're tugging at their ear and crying simultaneously, it's something that you need to worry about. Many parents will come and talk and say, oh, you know, Dr. my child is not feeding. I don't mean to trivialize feeding, but the truth is that every child in a casualty are all not feeding very well. What the pediatricians are waiting to hear is if the child is not drinking, because if you don't drink, you're going to get dehydrated, and that is a serious thing. So if a child has just not drunk a drop of fluid for 4 to 6 hours, I would start being a little bit worried, and I would rush to the nearest casualty. Of course, if your child is vomiting, that is an indication to rush to the hospital, but I wouldn't necessarily rush with the first vomit. There's a medicine in the market called emetino. So if your child starts vomiting, should your child have Down syndrome or otherwise, you'd want to consider giving a single dose of emetino. For this talk, wherever I write DS, it's in regards to Down syndrome, because I wanted it to be tailored to you the parents of these beautiful, beautiful children. So if you see them breathing very fast or turning blue or going blue in the tongue, that's a serious warning sign for you, and you would have to rush to the immediate nearest casualty. For Lily and Emily, I'm happy for parents to type in questions into the chat box. We don't have to have the questions right at the end. I'm happy to take questions as we go along. So if you just type them into the chat box, then the organizers will be stopping me every so often where relevant, and we can be taking questions along the way. So please don't wait till the very end. I like to do this with you as we go along. So how would you treat this child who has the common cold? We mentioned earlier that fluids are very important, and doing saline nose drops is also equally important. For small children, I like saline nose drops. Saline just means salty water, and you can put that into the nostril every 4 hourly or 5 hourly. But a lot of parents will say, it's always a fight. And I always feel that giving saline nose drops is actually a two-man mission, because that child is not going to sit and look at you coming with a tube towards the nose. And then you have to do it several times in a day. I think sometimes as parents, we fail because we'll put the saline nose drops just once or twice in a day. But the truth is that the more frequently you put it, the better. And it's also important, parents, to know that saline nose drops is not truthfully medication. So even if you put it 10 times in a day in the nostril, it would not hurt your child, nor would it cause any side effects. Honey for children over the age of 1 year, which is also what I'm licking on as we speak, is also very important. Honey is a natural antibiotic, a natural antimicrobial, and so it's very, very useful to preventing cough in children. Of course, fever medications when you have a cough and a cold are important. But remember, medications like paracetamol and brufen are also pain relievers. And so sometimes we're just waiting to give paracetamol when we see fever, but then our children also have aches and pains. So it's important to also think about that as well. I wanted to share with you how I would handle fever, because I think that's something that we sometimes are not too clear about. So where I write, if I can take your eyes to bullet number C, bullet number 3, sorry. The C stands for paracetamol, i.e. Calpol, and the B stands for brufen. I'm not promoting any particular brand, but just to give parents an idea. So if you're going to do the paracetamol every 6 hourly, you'll notice that from C to the next C is 6 hours. So you'll be able to do paracetamol 4 times in a day, because 6 times 4 is 24. So that we don't lose each other, let's go through this carefully. From paracetamol to paracetamol is 6 hours, but in between you can do the brufen at the 3rd hour mark. And this is the best way to take care of fever relief. So you do the paracetamol, 3 hours later you do the brufen, 3 hours later you do the paracetamol, and 3 hours later you do the brufen. So every 3rd hour you have the alternative drug. Bullet number 4 talks about paracetamol and brufen mixtures. I'll give you examples in the market. There's Bruston and there is longterm. Now, what you do is you force a child to take both the paracetamol and the brufen at the same time. So you're not giving the child an opportunity. I mean, why would you give 2 medications if you can give 1 medication? So I tend to prefer the bullet number C, 3, where you do the Calpol and the brufen. My last bullet here, and you see I put it in caps, is how to tepid sponge. Parents about 100 years ago or 200 years ago, whatever it is, I mean, there were no pediatricians and there was no medication. Yet we had children who had fevers. So how would those parents sort out fevers at that time? So the best way to do this is to completely undress your child, and maybe you just have the pamper on, and then you get a bowl of warm water, and you put the warm water all over the body of the child. And then you allow the child to evaporate dry, so that we're not lost. I'm naked in front of you. I just have my undershorts on. There's a bowl of warm water, not hot water, not cold water. just warm, like the warmth of, just less than what you take for a shower. And then you've applied the water on my entire body, and then you're leaving it to evaporate dry. The process of evaporation sucks the heat from the middle of the body and then takes it out into the environment, which is what we want. So, like, for example, my wife and I, when our children were small, we would just do tepid sponging and try and avoid the paracetamol and the brufens, because the spirit of our thoughts was the least amount of medications is what is necessary. So I hope that is clear. Is there any questions that you'd like me to go through right now? Yeah, I see someone.
Somebody
Yes.
is asking which honey you are taking, since most of what is in the market is adulterated.
Oh, lovely question. So the thing is this, yes, most of the honey appears to be adulterated. The back of the throat is soothed when you use honey or something called glycerol, which is high dense sugar. So it really doesn't matter whether you use adulterated honey or natural honey. Now, I don't want to be misinterpreted. I'm not saying let's all go look for adulterated honey. What I'm saying is that I would rather use adulterated honey than a cough mixture, because a cough mixture has far many more side effects. Of course, if you can guarantee that you can get pure honey, that is what we are advocating for. So between adulterated honey and a cough mixture, I would never take a cough mixture. That's the message that I want to go out there. Is there another question that I can take before I proceed?
Yeah, there is a question on some paracetamols have been banned in some countries. Is it still
Yes.
safe for us to give to our children? And then the other one is a lot of people are talking highly about propolis drops for flus. Does it really help?
Okay, so I'll take the first one, which is the paracetamol. It's just one or two brands that were banned because it was found that they didn't have enough paracetamol inside. So there was a problem with the company that was making it. But the paracetamol itself has not been banned. So there is Calpol in our city, there is Efferalgan, there's Parol. There are a few of them in the market, and they are safe for you to use. When it comes to propolis, I've, with God's grace, been a doctor for 20 years now. So for the first 7 to 10 years, we used to talk about honey. Then for the next 5 to 6 years, we used to talk about manuka honey. And now over the past 4 or 5 years, people are talking about propolis. Dear parents, that is money spin at its best. I promise you, you just need good Kenyan honey. You don't need the propolis. You don't need the manuka. It is all money spin. It's just made to make you feel you're buying something that you have no knowledge of. And in this world, what sells is what you are not aware of. If I tell you honey, you are all experts as good as myself. But if I tell you propolis, that sends a shiver down one or two of you. So please don't waste your time with the propolis or the manuka. Just buy Kenyan honey. Is there another question?
Dr. Waris, a question on the honey. Seeing that we're looking at young children, at what age should we give children honey?
Okay, so we're advocating for honey from the age of 1 year onwards. That's when we advocate. There are some people who will turn around and say, oh, you know what, every time my child takes honey, my child vomits. You'll have a few parents who might mention something like that. So what you can do is sometimes you can mix the honey with a little bit of lemon juice. That tends to dilute the intense sweetness. So that can sometimes work. The other thing that you need to remember is that honey will always have pollen inside it because the bees are going from flower to flower. So the honey also has pollen inside it from various plants. So if your child is vomiting quite a bit with honey, number one, say from Mua Hills, for example, you could go and buy honey from Kisumu or from Makindu or some other place. And because the flowers in different parts of Kenya have different pollens. And so you might see that your child might benefit from honey from another area. Any other questions before I proceed?
So Dr. Waris, touching on the fever control.
Okay.
If you have a young baby, let's say below 1 year, and they have a fever that's lasted for 12 hours, it's not coming down, they're not vomiting, or maybe 12 hours to 24, they're not vomiting. In that case, should the mother continue following, the protocol of trying to lower the fever, or what would be the guide?
If your child has Down syndrome, then you would be erring on the side of safety and at least touching base with your pediatrician. So sorry to divide the conversation into those who have and those who don't, but we have to understand that when we're dealing with children who have Down syndrome, we're also dealing with a vulnerable group, so we need to be a little bit pro-aggressive about them. So if a child, for example, does not have Down syndrome, then I would wait for another 24 hours and see. So as long as your child is drinking plenty of fluids, passing urine, not vomiting like crazy, I would observe. But if the child had Down syndrome, I'd be asking you to at least touch base with your pediatrician at that point in time. Is there another question?
Thank you. Yes, Dr. Waris, we'll take this question and then maybe move on and pick other questions later on.
Yeah.
So one of the attendees says, my son gets sore throat when he takes anything with sugar, even medicine. What might be the problem? Or what would you advise?
Okay. The thing is that the fact that that parent is giving a child medication is because that child is already sick. So it's most likely that that child has a viral throat infection like I have right now. And so then I take the medication and then I believe that the medication is the one that is causing my throat to get a bit sore. There's this, it's kind of a fallacy out there that parents will turn around and say, my child is allergic to sugar. The truth is, no one's really allergic to sugar. But what you could be allergic to is the ingredients that are now being used to constitute a lot of these medications and foods as well, which is something I think that we need to really discuss today. So remember that a lot of these products have E numbers and sulfites and fortifiers and colorants and flavorants. And each one of those statements that I've made, sorry, it's a little bit heavy, but each one of them can cause irritation to the back of the throat. So that's what that parent needs to take a look at as well.
Thank you, Dr. Waris. We can go to the next part. Thank you.
It's very important when we are having children who have Down syndrome and others as well, that once their nose is blocked, it's very difficult to fall asleep. It's very difficult to breathe. It's very difficult to drink. And our little children with Downs also have a slightly smaller nasal bridge, so their noses tend to get blocked a little bit more than the average child. So a lot of this mucus can also drip onto the back of the throat, causing a concept of postnasal drip. So it's very important to open up the blocked nose. So in slide number 2 or number 3, we talked about doing the saline nose drops, and I stressed the importance of using the saline nose drops as frequently as possible. But I also want to warn parents that there is medicines in our market called Otrivin. And Otrivin has something called oxymetazoline. And Emily, these slides you're free to distribute them to everybody who has attended. So no one needs to take notes as well. But these are very dangerous. This oxymetazoline will increase the heart rate of your child and the blood pressure of your child. And if you look at the packaging insert, it says not for children under 12 years of age, yet they're being dished out left, right, and center. Also, be very careful of steroid nose drops. I think we need the time has come for us to ask clinicians, including myself. So do not exclude me from this. That you come to Dr. A and Dr. B, and I think 2 questions should always be asked. Is there a steroid in any of the medications you're giving me today? And is there an antibiotic in any of the medications you're giving me today? And I think that is the right of a parent to know. Bullet number 4 talks about doing the saline nose drops best before a feed, because At least it opens up the nostrils before a breastfeed session. You can also instill it when necessary, and you can also use a bulb syringe when everything else fails. I'm not a great advocate for bulb syringing and aspirating from the nostrils because I think we tend to damage the nose and then it becomes very hard for the child to breathe thereafter. I'm sure, dear parents, you have seen a lot of snoring for some of your children. I would, as a pediatrician and as a chest doctor, worry about it if it's happening daily and the whole night, not just when the child is sick. And also be careful if your child is pausing to breathe in between the snoring. So if your child is breathing every day and the whole night and pausing, bullet number 3, then please go and see your pediatrician because that's something that's very important. Your doctor might want to do an adenoid X-ray. But just remember that just because the adenoids are large doesn't mean they have to be removed from every single patient. You need to have a very close discussion with your caregivers because children with Down syndrome, sometimes if you remove the adenoids, you can end up having more problems because the adenoids were there almost keeping the airway patent, so to speak. So sometimes they need to be shaved rather than totally removed. And so this is something that you need to discuss with your ENT surgeon and not just have things being removed wholesale from your child. So it's something that needs a lot of conversation with your doctors. I always have a saying, if anyone's going to operate on my child, I'm going to get at least 2 doctors to agree that my child needs surgery, and it would have to be 2 doctors who I absolutely trust. So this, I think I touched on some of this. Honey is an antibacterial, use it over 12 months, etc. You know, in this world of ours, we are using antihistamines for too many things. Imagine my nostrils are blocked because I have a common cold and I take an antihistamine like Zytec or Piriton, and the medicine goes into my mouth, into my stomach, and into my entire bloodstream just to treat 1 inch of my nose. That doesn't make any sense at all. I would rather do saline nose drops any day. We have to understand that our children are precious and we can't have us pumping too many chemicals into their bodies. So I would always do saline nose drops. And I forgot to mention that even a saline nose spray would be useful as well. There's so few parents who know that Piriton actually has 6% alcohol. And I remind parents that beer has 3%. So you can imagine we are doubling the dose of alcohol when we're giving Piriton to our children. So overall, studies have shown that antihistamines are not useful, and I would never be giving my child Piriton in this time and age. As your children grow older, and for example, me with my sore throat today, you could salt water gargle. But there are also a lot of other gargles that are in the market that people are peddling. There's Andolex C and Betadine and Vocadin, just to mention a few names. A lot of these products are iodinated. Now, I want to remind us as adults, when we gargle, we're always choking every so often as we gargle. And so we'll swallow some of the products that we're gargling with. And I'm talking about micro amounts. Now, if you swallow enough iodine, you're going to start messing up your thyroid later on in life. There are no studies, there are 0 studies, dear parents, that have shown that any of these products work better than salty water gargle. Yet there we are buying Betadine for 950 shilling and I don't know what for 1,500 when 50 cents worth of salt will sort you out. Drug pharma doesn't want you to know this, dear parents, because drug pharma wants your money. Doctors are also getting scooped up in all this because some of us are getting corrupted by the industry that surrounds us. And I think you understand what I mean by that statement. So let's go back to the past. Let's go back to our grandparents' advice of honey and saltwater gargling. Please be careful about how many antibiotics you use. Also be aware that you might sometimes need to rotate antibiotics. Let me give you an example. You take your child to the doctor, and the doctor says your child needs an antibiotic and decides to give you Augmentin. Okay, so you trust the doctor, you believe in his judgment, you take the Augmentin. And then 1 or 2 months later, your child is sick, so you go to the same doctor or another one, and he wants to give you Augmentin again. That antibiotic will never work the second time around because the bacteria in the body have already tasted the Augmentin, and so they're already stronger than on the Augmentin. So you need to rotate antibiotics. So this conversation with you, dear parents, is not to make you a doctor. But I would strongly suggest that whenever you give your child an antibiotic, write down the name of the antibiotic in your cell phones. Because the next doctor you're going to, or the next casualty you're going to, it might not be the same person who has access to what you used prior. So at least let the doctor know which antibiotic you got the previous time, so that he then also rotates the antibiotic to something else. There are also antibiotics of different strengths. So please remember that when you're using Rosafin and Orolox, those are top order antibiotics. And you need to try and help our children by working with first-line antibiotics first. We are not here to lose our children. We want what is appropriate for our children. So I just want to share with you that when you look at bullet number 2, and I've written there amoxil, I need you to know that the WHO recommends amoxil for treating pneumonia in children in sub-Saharan Africa. So we're not trying to deny your children good medication. What we're saying is we can work with a first-line antibiotic without going to antibiotic second line and third line strength. I hope, dear parents, that you're aware that cough mixtures were banned in 2007. I hope you're aware that rhinathiol and bronchicum and ascoril and brozedex and linctifide and actifide and mucosolvan and benylin were all banned in 2007. Yes, I know it's in the shops. Yes, I know you're surprised to hear it. Yes, some of these drugs are made in France, but not distributed in France. How do you make a medication in France and only sell it to Black Africa? I feel there's a lot of neo-colonization, there's a lot of high-level corruption. I can't understand if it's terrible for the French child, why you would sell it to the African child. So please remember, there's a lot of issues when it comes to corruption, doctors on the take, million-dollar companies that one has to deal with. But at the end of the day, I'm not the one making the rules. The WHO states very clearly that all cough mixtures should be banned. And the only thing that you need to use is honey for children over the age of 1 year. I know this will generate a lot of questions, so we'll tackle them as they come. How do you prevent the common cold? For children who have, and I'm so sorry to categorize those who have Down syndrome versus those who don't, please forgive me. It's not meant in an offensive manner. But for those who do have Down syndrome, I would strongly advocate for the need for the influenza vaccine, frequent hand washing. But please remember that cod liver oil, vitamin C, zinc, vitamin A do not work. During the COVID pandemic, these things were fronted by drug pharma so that they could sell something. But the truth is that none of these work at all. Emily, can I stop there for a minute? Is there something? Are there some questions you'd like me to take?
Yeah, there is a question. How about using turmeric, ginger, and honey mix for coughs?
Thank you. This is going to sound very strange, but it's my people of Asian descent who brought the turmeric into vogue. But the truth is that there are no studies that have shown that whether you add the turmeric, it actually makes a difference. It was initially used as a gastric irritant. What that means is that you swallow the turmeric and then you get so nauseous from it that you cough and then you vomit out all these globs of mucus. And so the Asian person turned around and said, aha, look at all this mucus that's coming out of my child, but what they didn't realize is it's not coming out of the lungs. When you vomit, things are coming out of the stomach. So my ancestors missed the boat here a little bit. And I know I'll probably get some flack if there are people of my skin color out there listening to this right now. But what is necessary is the honey. That is the most important ingredient. I would never add turmeric. When my children are unwell, I give them pure honey. When I am unwell, I take pure honey. And
thanks, Dr. Waris. There's a question about frequent nebulization. I believe this is in regards to cold, blocked nose. What's your take on that?
okay. It depends what you're nebulizing with. So if you're nebulizing with salty water, then you'd rather put the drops of saline nose drops directly into the nose, because that will be quicker, faster, cheaper than nebulizing. Now, there's also nebulizations that you can use for the chest, but those are high dose medications, and it wouldn't be something that I would be recommending for us to do at home. So if the doctor in the casualty decides on nebulization, then that's fine. I'm so sorry that there's going to be a lot of conversation that revolves around drug pharma and the greed that they have. But we need to protect our children from the dangers of big pharma and the medicine and the money that they want from us. So routinely, for the average child at home, including the child who has Down syndrome, I see no need for nebulizations. And just to give you an idea, most of you might know the medicine ventolin. So I don't know if you're aware that if you nebulize a child with ventolin, it's equivalent to 75 puffs of ventolin spray itself. I hope I haven't lost you with that statement. If I give you 2 puffs of ventolin, I can open up your lungs. I haven't nebulized you. But if I nebulize you, I'm going to nebulize you with equivalent 75 puffs. And then I'm going to do it 3 times in a day. So that's 200, and I don't know how many, 210, 200, and whatever it is. So please remember that when you're nebulizing, you're using high dose medication. So I would never use that. Emily?
Dr. Waris, that's a new one for me, 75. Wow. That's the whole container of ventolin.
Exactly. So if I nebulize you 3 times, I've finished the whole canister of ventolin. Now, you'll then ask me, then why are the doctors nebulizing? You have to remember that when we are in the hospital and we're nebulizing you with oxygen. But when you're nebulizing at home, you're nebulizing with air. You get that? So in hospital, it's the oxygen that is driving the nebulizer. So that's because your child is sick, your child is breathing fast, so we're giving you the oxygen. But at home, you're just giving the room air, which is 21% oxygen. And this is something that many people are not aware of. So, I'm a respiratory doctor, but not all my patients are at home on a nebulizer. The number of children who are at home on a nebulizer in my practice, and it's all largely chest medicine, is like 0.2%. 99.8% of all my patients never go home with a nebulizer. So by the time you're regularly nebulizing your child, you at least should have touched base with a chest specialist to make sure that it's absolutely necessary. Emily?
Thank you for that, Dr. Waris. So we have a few more questions. One of them is how to treat a child with a cough that, it's all day and running nose all month. What do you do?
Okay. Truth be told, that child needs to be seen, because you see, that's not going to be the common cold. That's going to be something more than the common cold. So on a Zoom meeting, I wouldn't be able to tell that parent what to do, but already my flags are waving that there's a possibility that this patient has allergies and not infections. And so I would urge that parent to seek help from a good pediatrician or a chest doctor that they know. Emily?
Thank you for that. So there was a question around if the flu vaccine is back, it's available, because it was out of stock sometime, based on the recommendation you gave.
Yes, it is back, but the one that we're having now is going to expire in December. So, if you're going to take it in, middle of October, and then in January you're looking for another one, it would be the worst time to take it. So I suggest you wait until January.
Okay. So what are the long-term effects of ventolin and Flote if a child is taking them? Yeah.
Okay, so for the parent who's asked that question, ventolin and Flote are medications that are used for asthma. So, no one is going to sit and talk to a parent and say, this medicine has 0 side effects. Every medication has to have something that they're going to be doing to the human body. So we have to first say, does your child really need the Ventolin? Does your child really need the Flote? And if your child really needs it, are you using the least amount of medication possible? Flote and Ventolin are otherwise relatively very safe drugs. Both of those are medications that I have used over the past 18 to 20 years. I have seen side effects from Ventolin in maybe 100 children in over 20 years of practice. And I've seen side effects of Flote in maybe 15 patients in over 20 years of practice. And those two medications, dear parent, that you've mentioned, are ones that I use like 15 times in a day. So it's something that I use very frequently. But I'm not here to tell you that they don't have side effects. What I'm here to tell you is that, does your child really need that medication? Are you using the smallest amount of medication possible? And are you touching base with the doctor regularly to oversee the Flote and the Ventolin? Because Flote is a steroid inhaler. And then, of course, you have to remember that if you're given Flote, it's because your child has asthma. And you don't also want your child to suffer from the wrath of the disease, because the disease can also damage the lungs as well. Emily?
Thank you, Dr. Waris, for that clarity. I see a comment where one of the parents or attendees is saying, sadly, we don't ask doctors what medications they're using to nebulize. And sometimes you find, you are the doctor and I'm seeing Dr. Waris. How can I question? So maybe you can guide or empower those that are listening to you today.
Yeah, that parent is so right. And it's only because it's so dramatic when we start nebulizing your child and we think we're giving you something so great, which it is, when it's necessary, it's necessary. But I don't take offense when a parent comes and tells me, I need to know the ingredients of the medications that you're going to give to me today. Because I always ask myself, what if I'm the parent and you're my doctor? I would really want to know the medications that I'm going to put into my daughters. So I think that Kenya today is a different Kenya from 20 to 30 years ago. 20 to 30 years ago, we would go to the doctor and then the doctor would dunga us in the matako with some fluid that we had no clue what we were getting in that equation. Now there's no way I would accept an injection into my body. After COVID and all these other things. So I think it's from talks like this where we learn that nebulized medications are stronger, and that you, the parents, have the right to ask. I don't think you're being rude. I know there are many doctors who take it differently, but there has to be a wind of change. And at the end of the day, it is a service to you, the parents, and for your children. I would never give my child any medication that I did not know what was in it. And I believe that you have the same right as a parent as well as anybody else. Emily?
Thank you for that, Dr. Waris. There was a follow-up question on the nebulization. So one of the attendees is asking, how about isotonic solution?
To nebulize?
To nebulize.
They are, sorry to talk about studies, but that's how we get our knowledge. There is no role for nebulizing your child with isotonic saline. Uh, I mean, there's no chest condition that I would be using isotonic saline for. There's something called hypertonic saline, which is 3% hypertonic saline, 3% salty solution. That might be useful, but for isotonic, to answer the attendee's question, there is no role for that medication.
Okay, and possibly the last question, Dr. Waris. So if you're making your own saline solution at home, what would be the guiding ratio? You know, if I've never done it, I don't want to go to a trusted search, Google. Is it a pinch? Is it a spoon? Maybe you could also guide.
Yeah, please don't do it. Because you see, my pinch of my fingers is going to be different from yours because our sizes are all different. And then how many mLs are you going to put it in? Since saline nose drops cost 70 shillings and they last you till the last drop because salty water doesn't expire, I'd strongly urge you not to make the salty solution at home. The reason is that if you make it too dilute, you will have one problem. And if you make it too concentrated, you will have another problem. It needs to be 0.9%. And I personally can't make you 0.9% in my house here. So please buy the saline nose drops.
Thank you, Dr. Waris. It's good to know there are 70 shilling salines out there. You can ask for them at the pharmacy and not buy the 700 shilling one.
Yes, it's you see, Emily, it's because we are buying brand names. We are buying Sterimar and Calpol and that kind of thing. I can give you a cheat if you guys want. If you go to your pharmacy and sorry, you'll have to write this down, dear parents, and just ask them for 0.9% sodium chloride. 0.9% sodium chloride. And you can get a big 500 ml plastic container and that will last you for a decade. Emily, I can go on.
Thank you. Yes, thank you, Dr. Waris. I see a question here. Possibly we're going to talk about it later on. Ismat is asking about Montelukast. I've never come across it, so very interested to hear what it's about.
Montelukast is medication that is not a steroid, that is used to treat asthma and children who have allergies of the nose. It's not first-line medication. It has potential side effects, and it should only be used if, you know how we were talking about the Flixotide and the Ventolin a little bit earlier? So if the Flixotide and the Ventolin is not working, then you would consider adding Montelukast. But even when you add Montelukast, you'd use it for short durations, not long durations. I'm always fond of saying, use medicines that are locally targeted. So if I have a problem in the nose, use a nose spray. If I have a problem in the eye, use an eye drop. If I have a problem in the ear, use an ear drop. Try and always avoid the mouth, because once you put things into the mouth, it's going to the entire human body. So I am a heavy prescriber of Montelukast just because of the profession, the subspecialty that I'm in. But it's not a medication that I would love to give to every patient. So please don't take it that easily. I hope that answers Ismat's question.
Yes, thank you, Dr. Waris, and they can always have a follow-up. So maybe, yes, we can go to the next part.
I need you to know, dear parents, that the typhoid vaccine is one of the most useless vaccines in the world, that there are many people out there giving your children 2 meningitis vaccines, whereas if you just got one, it would suffice. The drug pharma industry are trying to ensure that you give it to your children at 10 months because they did a study at 10 months and then repeated the vaccine at 15 months. But what you're not aware of, dear parents, is that if you just did one vaccine after the age of 1 year, you would not need 2. The meningitis vaccine is one of the most expensive in our country. It costs close to 10,000 shillings. And you can imagine you're doing 2, so that's 20,000 shillings. And there are people who don't want you to know that if you waited for one, at the age of 1 year, you only need 1. So there's a lot of money spent, because if I sell you 2 vaccines, I double my profit. But if I sell you 1 vaccine, I only have single profit. So please be very careful about that. For children who don't have Down's syndrome, please don't give the flu vaccine. It's not a great vaccine. It has very little in its efficaciousness. Just to give you an idea, all of us are now COVID vaccine experts. And we all turned around and said, we don't want the J&J for 66%. We want the Pfizer at 83. Then I want the Astra at 90. I don't know what. The flu vaccine's efficacy is between 10% and 40 to 50%. So it's close to useless. But you see, you're giving it every year, so there's a lot of money to be made. Also, remember that the cholera vaccine should only be given when there's a cholera outbreak, not routinely. So please be careful of the money spin and the power of drug pharma out there. Please be careful of how many vaccines we're going to put into the bodies of our children up to the age of 1 year. I mean, surely, the list is ever endless. I need you to know that there are appetite stimulants in the market. Sometimes it's necessary for the children who have Downs. But remember that they contain an ingredient called cyproheptadine, which interferes with memory and brain function and neuronal function in the brain. So it's something that you need to be very careful about. We'll get parents who come to the casualties and say, oh, my child is not well and the appetite is so poor. And it's like a standard thing. And, I always wonder what the generations were like 300 years ago. I don't think they forced children to eat food. I mean, the food was there and the women and the men were doing their chores and the children were left on their own to do their thing. No one was force feeding their children. So I sometimes think that we have to also accept children who are slim. You don't have to be fat and obese to be healthy. So appetite stimulants, unless it's a child who has significant failure to thrive in the era of Downs, I wouldn't give it to every single child, because